Good afternoon, everyone, and welcome to the Get Healthy America show. I'm Steve Barrick, and for the next hour, we're going to be talking about the wonderful world of wellness, the MAHA movement, what's going on with wellness and Washington, D.C., and we're going to do it with the star of our show. She's none other than a world-renowned naturopathic physician. She's gone all around the world talking about wellness issues for a number of years now, and she's Dr. Gina Nick. Good afternoon, doctor.
Good afternoon, Steve. And thank you all for tuning in to listen to our show. Today, we're going to dive into some new legislation that has just passed involving mercury. We're going to talk about the whole pesticide issue, which is becoming quite heated these days, and also protection, what you can do to protect yourself from all of this.
Where can listeners reach out to us if they want to participate in the show, doctor?
And please do reach out. You can give us a call at 866-870-KRLA. That's 866-870-5752. If you have a personal question, feel free to email me directly at drgina@drgina.com. That's DRGINA at DRGINA.com.
So you were talking a little bit before I so rudely interrupted you, doctor, about some recent legislation and the news about pesticides have been a lot in the news lately. Can you talk a little bit about that?
When did you rudely interrupt me?
Oh, about probably 5 to 10 to 25 times a day.
No. So anyway, let's start with what's happening with the Thimerosal ban. So this just passed like yesterday. And it was Secretary Kennedy officially signed a policy directive to adopt the CDC's Advisory Committee on Immunization Practices, or ACIP's recommendation to remove thimerosal from all mercury-based preservatives from the U.S. influenza vaccine. And so that's new. The directive follows a 51 vote during the ACIP's June 25th, 2025 meeting, where the committee recommended that flu vaccines for children, pregnant women, and adults contain no thimerosal.
So what does that mean? Like, what are we talking about here?
So thimerosal is basically a mercury-based preservative. And so I don't know about you, but I grew up with something called mercurochrome. So if you'd get a cut, you would put that mercury right on your finger or whatnot. And we didn't know back then. Our parents didn't know. Yeah, that mercury is a major neurotoxin. It is extremely toxic to the body. And so this is a positive move to remove one of the major known toxins from vaccinations. And that should really help again with limiting the toxic load that we're putting into our children and adult bodies on a day-to-day basis. So this is a good step in the right direction. A lot of the vaccines don't contain thimerosal today, but this is kind of like the next step in saying, hey, all flu vaccines will be free of this thimerosal, which and this has been a controversial topic for so many years. And I can appreciate that because, like I said, mercury is a known neurotoxin. When I say neurotoxin, it means it causes damage to the brain. And we don't need that. Our kids don't need that. And so I see this as a positive move. Some critics say that this decision was based more on ideology than on scientific research. I don't see it that way. The research is clear that mercury is toxic. And so it's positive. It's one step. We've got many, many, many steps to take, but this is one step in the right direction in terms of, protecting the health of the American people.
So this is another big win for Secretary Kennedy and the MAHA movement in Washington. I mean, so doctor, in your opinion, you've been following these issues for years. Do you think you would have seen this type of action occur in the past?
Well, it hasn't occurred. I mean, I've been talking about the dangers of mercury for a long time, not just in vaccines, but just in general, being exposed to mercury vapors in like dental amalgam fillings and so forth. And so I have a lot of colleagues who are actually dentists that are very happy about this move because it helps these dentists that have been trying to educate people and have often been shut down when they've said, "Hey, mercury amalgam fillings are toxic to your body. They're putting them in your mouth. That's directly goes up to your brain, right? So there's a direct impact there, and a systemic impact as well. And so this ban will also, I think, lead to some changes even in the dental industry. And so I know, like I said, a lot of my colleagues who are dentists who have been, talking about this for years and sometimes have been silenced are now like really happy about this step. So this isn't just something that impacts flu vaccines, but it's about, and I'm always about education. People are starting to ask, like you just did, what's thimerosal?
Right.
Why is this such a win? What's the deal here? Again, mercury is toxic. It's a neurotoxin, and we want to minimize exposure every which way we can.
I think it's 2 weeks ago now, we you and I were on a call with the White House liaison's office and talking about MAHA in particular and this new dynamic in health. And what have you seen in these 6 months of the Trump administration with Secretary Kennedy? Like, what changes have you seen as it relates to their desire of the administration to collaborate with doctors like yourself on issues like this?
They want feedback. They want to collaborate. They want more information, to make the best decisions possible for the American people. That's what I've seen, being in the trenches day in and day out with patients, et cetera. I see that they really do want the feedback, and they're doing what they can to start to implement changes that they feel are best for America as a whole. And so I see it as very, very positive. And again, it's one action that can have far-reaching implications, right? Like again, even in the dental industry. So people are now going to start to ask, what's thimerosal? What's the deal with mercury? Why is that dangerous? And so again, it helps in educating people about these toxins that we're exposed to on a regular basis that we don't even know about. And so I think this move, again, while the critics say, well, a lot of the vaccines don't contain thimerosal anymore, well, some of them do, this move is more far-reaching than just the vaccine conversation.
I think what's fascinating, well, not fascinating, but amazing is, I mean, can you even speculate as to the number of Americans that take a flu vaccine every year? I mean, we're talking about 100 million, 50 million? How many are
Yeah,
we talking?
I don't have the number on that, but it's a lot.
Right.
It's a lot. Most people do get the flu vaccine, and so again, everything we can do. What I see with MAHA is they're taking a multifactorial approach to moving the needle back towards health in people, in the American people, versus towards disease. So I always say like there's this spectrum, and you're either going one way towards disease and death, and the other way is towards health and wellness and well-being. And so this is one move that helps to, turn the corner. If you're heading towards disease, death, it helps to turn that corner back over to health and well-being. And it's one move. And so I celebrate this as a positive change that, again, I think we're going to see the benefits of this are far-reaching.
Well, I think you hit the nail right on the head. I mean, when you talk about these toxins, especially like mercury, and they're in your body, like you were talking about, fillings and different things that have mercury in them. I mean, how do these toxins impact the body? I mean,
Yeah.
what do they do to us?
Cause disease. They cause disease. And the body is brilliant in its design. I always say this. And what we know is like if you're exposed to mercury, the body will do its best to store it. So it's not in your general circulation on a day-to-day basis where it's poisoning you, second by second. So it'll store it. Where does it get stored? In the brain, in the liver, in the bones. And so that's great, but your body can only take so much. And I'm always talking about the body's always trying to maintain a state of balance or homeostasis, right? Well, this is one way that it does it. If you're exposed to mercury, your body's going to try and store it. right? And so when I'm testing patients in my practice for mercury, we'll do what's called a pre and a post provocative test. What does that mean? It means we'll test your blood and see what mercury is circulating in your blood right now. And that could be, it could be higher if you, let's say, just got the flu vaccine that happened to have thimerosal in it, right? Or you just got an amalgam filling put in or even taken out, right? You're going to have a higher exposure to mercury. And so that'll show up in the blood, right?
Yeah.
What I'm even more interested in is what's called the post-provocative test, where I have patients take something that helps to draw mercury out of the bones, out of the brain, and then we test the blood and we see what's there. And it's amazing to see the number, 9 times out of 10 is a lot higher in that post-provocative test where you're helping to pull stuff out of storage where it's then circulating in the blood. And, at the end of the day, your body can only store so much. And then what damage is being done to the bone, the brains, et cetera, with all that stored mercury. And so,
doctor, I don't mean to cut you off here, but we got 30 seconds left in this segment.
Yeah.
If you guys want to reach out to us, call us at 866-870-KRLA. That's 866-870-5752. And when we come back, doctor, we're going to be talking about some cutting edge science that I know the listeners are going to be very, very interested in.
Yeah, stay tuned. Got a lot to talk about today.